The Affordable Care Act, new health care law, kicks off October 1st with the goal of getting all uninsured Americans signed up for a health plan. Rebecca Cooper joins us live with news on how the federal government hopes to get all Virginians enrolled when the new law goes into effect. Rebecca?
Well, that's right, Audrey. You know, we've been tracking plans for the launch of the Affordable Care Act. Yesterday, we brought you news on the district's plan to enroll its residents. Maryland has spent the past year preparing its coverage plans. Today, the Secretary of Health and Human Services announced two groups getting federal money to try and help Virginians get signed up. Here in Virginia, plans are still being formed on how exactly to get uninsured residents signed up when the Affordable Care Act becomes law or face a fine. Today, the Department of Health and Human Services announced a $1.2 million grant to Virginia's Poverty Law Center and a $480,000 grant to Advanced Patient Advocacy, LLC, to help get Virginians enrolled. Kevin Groner heads up APA.
They'll be able to enroll with us directly inside of the hospitals where we serve, but ultimately we will have outreach coordinators working within the local communities.
Following the recession, the number of uninsured Virginians went up 10%. The Virginia Healthcare Foundation estimates 15% of Virginians now under 65 go without insurance. Of those, a vast majority are working families and U.S. citizens. A breakdown shows 47% are white, 24% are black, 20% are Hispanic, and 7% are Asian. Governor McDonnell opposed the Affordable Care Act, and like several other Republican-led states, left it to the federal government to run it in the Commonwealth. Today, Virginia voters remain divided on the issue.
It's just another way to tax us more, take more money from the regular people, and it's just a big ripoff.
I think it's a great idea. You know, it's covered my personal birth control. It's going to cover my uninsured boyfriend. It's going to cover a lot of people who need health care.
Now, we know lots of our viewers have questions about how the Affordable Care Act will work, and we plan to keep our coverage going.